Okay, guys, let's talk once again about clinical importance of multiple pregnancy. So I received these questions that, no, actually it's all questions concerning these previous big exam questions, and let's clarify. That's why I'll try to clarify multiple pregnancy misunderstood or confusing questions on the big and board exam. So I'm absolutely sure it will be helpful not for your big board exams, but as well as in your future medical practice. Doesn't matter what neurospecialty you will choose. So take your pens and papers and let's go, my beloveds. Okay? So, vanishing twin syndrome. In the first trimester, one of the developing fetuses in multiple pregnancy may spontaneously stop developing and be reabsorbed, if you want, by the mother's body, by the mother. This is known as vanishing twin syndrome. Of course, very often, we can say always, almost always, mother and even clinician are unaware it ever occurred. So this is a vanishing syndrome. And what is clinical importance? It can skew statistics regarding twin pregnancies detected early via ultrasound. It might be associated with slight increase of bleeding or miscarriage for the remaining fetus. Okay, so this all concerning, this is a principal mode concerning vanishing twin syndrome, if you receive this question. Then, so this question happened. So if you asked about increased risk of congenital anomalies, monozygotic, that's identical twins in particular, have a higher risk of congenital malformations than singletons. This might be due to complex splitting process in early embryonic development. Dizygotic fraternal twins have only a slightly increased risk of birth defects above singletons. What is clinical issue of that? Required detailed and targeted anomaly scans, ideally with experienced sonographers, to identify structural abnormalities. Genetics counseling, why not, may be offered or recommended. Okay? Okay. Now about TTTS, TTTS, or twin transfusion syndrome in monochorionic pregnancies. So TTTS occurs in monochorionic twins sharing one placenta. Abnormal vascular connections in the placenta cause unequal blood flow, with one twin become a donor, anemic, small, and the other a recipient, of course. Polycythemic fluid overloaded. What is clinical issue of that? A major complication diagnosed through serial ultrasounds, monitorings, the serial ultrasounds, monitoring amniotic fluid levels and fetal bladder filling, requires specialized referral to a center with expertise in fetal therapy, for example, laser ablation of communicating vessels. Early detection can significantly improve outcomes. Okay? About high risk of preterm labor and delivery. Multiple pregnancies significantly increase the likelihood of preterm birth. So the larger uterine volume leads to earlier stimulation of labor. Twins average around 36 weeks gestation, triplets even earlier. What's clinical importance? Counseling patients on the risk of preterm labor is essential. Consider prophylactic progesterone is in some cases, though evidence is mixed. Be prepared for neonatal intensive care needs. Administer antenatal corticosteroids, betamethasone, dexamethasone, you name it, to promote fetal lung maturity if preterm delivery is anticipated. Okay? Good. Now about increased maternal psychological stress. Multiple pregnancies place a greater burden on the mother's cardiovascular, respiratory, and renal systems. Actually, not a psychological stress. I'm sorry, sorry. It happened. So, increased maternal physiological stress. Multiple pregnancy places a greater burden on the mother's cardiovascular, respiratory, and renal systems. They're more prone to gestational diabetes, preeclampsia, and anemia. So what is clinical importance of that? My beloveds, careful monitoring of maternal blood pressure, glucose levels, and hemoglobin is vital. Counsel on appropriate weight gains. Screening for preeclampsia should be initiated earlier in gestation. Get it? Good. You answer in this manner. So what about chorionicity and amnionicity determine management? So the number of chorions, placenta membranes, and amnions, sac membranes, dictates the complexity of the pregnancy and potential complications. Monochorionic pregnancies, especially monoamniotic, carry the highest risk. So what is clinical issue of that? Determining chorionicity and amnionicity early in pregnancy via ultrasound is crucial. It guides surveillance frequency and potential interventions. Monoamniotic twins require inpatient monitoring from viability 24-26 weeks due to risk of cord entanglement. Okay? Great. You answer in this manner anyway. Now about SFGR, selective fetal growth restriction. One twin experiences significantly restricted growth compared to the other. Obviously, it's more common in monochorionic pregnancies and can be due to an unequal placental sharing. What is clinical importance? Serial ultrasounds are required to monitor fetal growth. Management depends on severity and gestational age, ranging from expectant management to selective termination. Oh, God forbid. Okay, this is concerning SFGR. You answer in this way. Good. Now concerning increased risk of postpartum hemorrhage. The overdistended uterus is more prone to uterine atony, failure to contract after delivery, leading to postpartum hemorrhage. Clinical issue. Prophylactic uterotonics, for example oxytocin, are essential after delivery. Careful monitoring of uterine tone and bleeding is crucial. So be prepared for possible manual exploration of the uterus and administration of additional uterotonics agents. So, for example, misoprostol, carboprostot, tranexamic acid. Okay? So concerning of postpartum hemorrhage, risk of postpartum hemorrhage is this. So next question misunderstood. Mode of delivery considerations. Vaginal delivery of twins is possible under certain circumstances. Cephalic presentation of the presenting twin, adequate labor progress, availability of experienced staff. However, cesarean section rates are higher in multiple pregnancies, obviously. Clinical importance. Careful assessment of fetal presentation is essential. So be prepared for potential complications during labor and delivery, including malpresentation of the second twin. Continuous fetal heart rate monitoring is necessary. Absolutely. This is concerning mode of delivery considerations, my beloveds. So, and finally, psychological impact. Yes, you might receive this question. So, parents of multiple experience high rates of postpartum depression, no mother of course, anxiety and stress due to increased demands of caring for multiple infants. Screening for postpartum mood disorders is critical. Referrals to support group and mental health professionals should be offered, emphasize the importance of social support. Yes, why not? This is concerning psychological impact. So that's all concerning your misunderstood questions of the previous 2 years exam, several years exam, 3 years. I hope this lecture, little lecture, was helpful for you. Re-listening several times, please, my beloveds. Don't forget to follow and subscribe my Dr. Y YouTube channel, and especially Dr. Y Telegram channel. Telegram channel, my beloveds. Yes. So how to find my private Dr. Y Telegram channel? So the same name like in YouTube. Dr. Y, like question. What Dr. Y is me. WHY. Without question mark, of course. So you type in searching mode of Telegram, Dr. Y, WHY. You find this Dr. Y, you click start and you choose your plan. It's not costly at all, by the grace of God. Anyway, God bless you, my beloveds. I love you. See you on next lectures and especially on my Dr. Y Telegram channel. Bye-bye.